Where's Mike? Mike, Diane and Dementia 5. In Niagara, Diane was having trouble with words. She was not able to express herself. We saw several doctors. The last place we visited was the geriatric ward at the Greater Niagara Hospital in Niagara Falls. That's where Diane first started as a social worker before moving into private practice. She was assessed by a nurse. It lasted 1.5 hours. Diane was tested verbally as well as for short and long-term memory, spatial awareness, and such. She aced the first test but failed badly on the others. The nurse said that one test she failed was the test they used for taking away one's driver's license. She could not draw a clock to show a predetermined time. I watched the process in shock. I had to complete a 4-page assessment as well. As I witnessed the entire operation and observed her having so much trouble with the second test, it frightened me. We were booked in a couple of months to see the itinerant geriatric doctor in charge. Diane was worried. I was worried. Eventually, I convinced her she should not drive. We donated her car to Karen. Not being able to drive was extremely painful. I remembered the angst when I couldn't drive and how frustrated I was when forced to rely on others. I will gladly ferry you anywhere you want to go. Anywhere, I declared, anytime. We both knew that was not good enough, that her independence had been suddenly and irreparably usurped. I originally thought that the move to Ottawa was smooth. The Packers started a day earlier than we had scheduled. So we were on our way early the next day with first a visit to the surgeon in St. Catharines. He reported that Diane's broken ankle was now a work of art and healing nicely, to be confirmed with a visit to his medical referral at the Ottawa Civic Hospital. He stabilized her ankle with a plate and 8 screws. She hates her walking boot. She forgets to use her walker. She seems more mobile than squirrels that I observe cavorting outside our freshly painted and carpeted new abode. On December 12th, our 2 daughters arrived to help celebrate Diane's 78th birthday. Neighbors so far appear friendly, but COVID-19 keeps us apart. Karen recently suffered a pulmonary embolism, which scared us all. She recovered, but geez, we need no more adversity or yet another crisis. The doctor gave Diane a prescription for donepezil, proprietary name, Aricept. It escalates the level of acetylcholine in the brain. Acetylcholine is an important neurotransmitter involved in memory and other thinking processes. It's depleted in Alzheimer's disease and other dementias. Common side effects involve the stomach and digestive tract, usually mild changes resolved within a week or 2. Because this drug may lower the heart rate and Diane experienced heart rhythm problems, he wisely contacted her cardiologist. They agreed that the best course was to order a 24-hour ambulatory heart monitor. Results showed no evidence of serious slowing of the heart rate, so it was safe to take donepezil, starting with a tiny dose. The prescription began with 1/2 of the 5 mg tablet for 2 weeks. After no side effects, Diane started taking the whole 5 mg tablet for 1 month. Then she underwent a repeat electrocardiogram and increased to the full 10 mg daily dose. The usual effect of the medication is to preserve the present memory and thinking for some time. About 1/4 of the people who take this medication experience an improvement, although it may not be seen for up to 3 months. I constantly try to evoke myriad memories of things that we have done, places we have traveled to, and past interactions with friends. Diane responds well to these memories, but the aphasia, the difficulty with words, makes it hard for me to find out precisely where she is. She seems to lose more words every day. I counter this with Scrabble. We play every morning. We play cooperatively, trying to fill the board with no emphasis on scoring. We applaud each other with 5- and 6-letter words. Sometimes she is remarkable. But other times, I need to exert great patience waiting for her turn. If she is having trouble, I allow her to switch letters. The idea is to help preserve words. She makes spelling mistakes. She sometimes uses French words, which is neat because she started her career as a French and English teacher. I'm just happy that she seems to enjoy the process. I turn on the CBC for a classical music backdrop, which she loves. In Niagara, before we left, I took Diane to a speech therapist for about 20 sessions. She employed a lot of cognitive tests and quizzes that I keep in a binder for future use. Diane enjoyed the sessions. And I think they helped. Diane often thinks there are 2 of me in the house. She expressed similar confusion about Karen's presence once in our house. She seemed unsure how many people were living here. She seemed to think there were 2 Karens. At one point, she told me she wasn't sure she knew Karen well. She asked Karen questions about what kind of work she did. At other times, she was completely lucid and knew exactly who Karen was. They talked about her work and friends, and Diane had no trouble taking part in the conversation. I'm used to this up and down roller coaster from my youth and dysfunctional family, but it wears on the caregiver. Karen told me you can get a care coach from the Dementia Society in Ottawa. They provide many programs and resources, one of which I already accessed for Diane and me. It was a Zoom meeting involving an art expert at the National Gallery in Ottawa who gave 2 talks on some of the impressive works in their collection. I will call about a coach. I sure need it. Sometimes, I think I also need 40 ounces of Scotch whiskey. I have not resorted to any drug relief, but I understand the need to escape the here and now versus embracing it like a Zen monk. The pandemic increased drug abuse everywhere. Over 81,000 drug overdose deaths occurred in the United States in the 12 months ending in May 2020. That was the highest number of overdose deaths ever recorded in 12 months, according to data from the Centers for Disease Control and Prevention, CDC. In Canada, during the first year of the pandemic, there was a proportional 96% increase in opioid toxicity deaths compared to the year before. Since then, deaths have remained high. 7,560 opioid toxicity deaths occurred in 2021. That's approximately 21 deaths per day. In the years before the pandemic, there were between 8, in 2016, and 12, in 2018, deaths per day. I have used drugs, primarily alcohol, to escape, especially when young. There are times now when I think I might like to join the opioid stats above. A complete escape. Robin Williams, the great comedian and actor, acted in this fashion. He committed suicide in 2014 at 63 years old. Williams had been diagnosed with Parkinson's disease, but an autopsy showed he had Lewy body disease, a rare illness with symptoms that resemble Alzheimer's and Parkinson's. I often wonder why doctors are not more liberal with morphine to help us say goodbye. This is a YouTube video based on my Facebook entries on dementia. I welcome your thoughts and prayers, likes and suggestions, particularly if you are engaged in similar struggles.